Dr. Krista Jordan. I'm a clinical psychologist in private practice in Austin, Texas. And today I wanted to talk to you about the Psychobiological Approach to Couples Therapy, which is abbreviated PACT, P-A-C-T. PACT was originated by Dr. Stan Tatkin, who hails from the Los Angeles area. And Dr. Tatkin had had experience working in research of mother-infant pairs and attachment, and was also studying with Dr. Alan Shore, who is sort of the founder, one of the founders of the subfield of psychology known as interpersonal neurobiology. So Dr. Tatkin was working with couples and began noticing that these two different areas that he was studying, infant attachment, or had studied infant attachment with mothers and babies, and interpersonal neurobiology, or how the brain and the nervous system interact between two people. He noticed that these areas were showing up in couples. And so he began to, with his colleague Marion Solomon, put together a type of couples therapy which is very new, very innovative. Was the first couples therapy to integrate these two different areas in psychology, and put together this really fantastic mode of working with couples, which I think is just fantastic. I've been studying with Dr. Tatkin since 2008. I've used PACT since 2008 with couples with great results. And even though I have studied and even experienced as a client some different types of couples therapy, I still come back to PACT and feel like it is my absolute favorite way to approach couples. So let's take a look at PACT and see if I can give you the 30,000-foot view on what it's all about. For more details though, please definitely visit the PACT Institute or Dr. Stan Tatkin's website. Dr. Tatkin has a number of books and even a TED Talk out. He's also often a guest on podcasts, so there's lots of different ways to hear Dr. Tatkin talking about his own work, and I would definitely recommend that. He's a great speaker. But I'm going to take my best shot at it today. So again, PACT therapy integrates attachment theory and interpersonal neurobiology and brings those two subfields of psychology into the couple's relationship and helps us understand how those show up between couples. So really briefly, what do we mean by attachment? Attachment is a strategy that develops in early childhood. So birth to 3 is kind of the most significant period where attachment patterns are being laid down, although they can continue to be modified really throughout life, depending on if there's enough of a significant intervention. But birth to 3 is generally where these patterns really develop and kind of get their roots into our nervous system. And of course, we don't remember anything that was going on before we were 3 years old. So this is all happening before we have good conscious memories, which can make it a little tricky once those patterns start showing up in relationships, because it's operating really below the level of consciousness. And so a therapist is going to have to help tease that out and begin to show you in sessions where those patterns are showing up, because you're likely not aware of it yourself. So attachment is this infant and young toddlers' best strategies to figure out how to maintain a close relationship with their caregiver. And infants do this in a variety of different ways depending on the kind of caregiver that they have. If they have a caregiver who is really busy and doesn't have a lot of time and might not have a lot of emotional bandwidth, maybe a parent who's chronically overwhelmed, maybe a parent who struggles with depression or addiction, those parents don't have a lot of bandwidth for kids. And so some kids will learn to shrink their needs down and try to make as small of a footprint as possible in that caregiver's life. And those kids, if that becomes a consistent strategy, are known as avoidantly or dismissingly attached. And Dr. Tatkin talks about them in his work as islands. So we have our islandy people. And then on the other side of the continuum, we have kiddos whose parents were sometimes really attentive and really enjoyed engaging with the kid and giving them lots of attention, but then they would kind of pull back and get overwhelmed or be struggling with their own issues and not be able to take care of the kiddo. So they're kind of like inconsistent in their caregiving. And so the baby's best strategy here is to just keep signaling. So if I just keep letting you know that I need you over and over and over and over again, eventually you will pick up the signal and come to me. And so on that side of the attachment spectrum, we have our preoccupied or angry resistant, or Dr. Tatkin calls them the wave people. And these people are very big on emotions, big on expressing emotions, big on wanting to know your emotions, lots of interaction, lots of talking. And so these are sort of two ends of a continuum. And some lucky folks end up right in the middle, which is called secure. And what we know about babies and young kiddos who have the secure classification is that they just have an easier time in life. They actually have less depression, less anxiety, less divorce. So it's a protective factor. But roughly half of people reach adulthood with an insecure classification. So they're doing too much of making their needs small, or they're doing too much of really advertising their needs all the time, and they're just kind of way too far on the outskirts of the continuum and not really hitting that midpoint of security. And those attachment patterns persist into adulthood. This was really the brilliance of Dr. Tatkin, is that he saw that these patterns that show up so clearly in infancy, which we have decades of research on, they get grafted into our adult romantic relationships, and that becomes our template for how we expect to be treated in our romantic relationships and how we respond to the signals of our romantic partners. So Dr. Tatkin really saw that this thing that's happening so early in childhood, birth to 3, is actually kind of getting transplanted into adulthood without us realizing it, all happening at the preconscious levels. So in PACT therapy, one of the things that we're doing is we are taking a history about your early experiences with your caregivers, and we're watching how you respond to your partner right there in the session, moment to moment. And we're beginning to see which part of the continuum, or maybe in the middle, where does your attachment behavior seem to fall. And then once we can help you understand where your attachment behavior seems to fall and help your partner understand that, it really sheds a whole new light on interactions and where the problems are. And another great thing about PACT therapy is that we don't just help you figure out where your attachment behaviors fall on the continuum, but we help you figure out how to move those attachment behaviors into that middle zone that represents security. So one of the great things about the human brain, as far as I'm concerned, is that it is set up for learning. If you think about the number of things you have learned in your life, it's astounding. Learning to walk, learning to talk, learning to ride a bike, learning to read, learning to write, learning different languages. We are learning machines. And so there's no reason that through the guidance of a good therapist, we can't learn how to move from one end or the other of that attachment continuum into that middle zone where we are representing these secure attachment behaviors that we know are so protective and predict a happier, more content, more stable relationship. So PACT therapy is all about learning. It's about learning, where do I fall in this attachment continuum, and if, like about half the population, I'm not hitting that sweet spot of the middle, and I learned instead behaviors that were a little too far on one side or the other, how do those behaviors show up in my present relationship with my partner? And how do I, with the coaching of a PACT therapist, right there in session, moment to moment, making modifications in how I am approaching my partner, responding to my partner, how do I move from one end or the other of that insecure attachment into that secure zone so that my partner and I can really experience the benefits of security? And it is wonderful and beautiful to see couples helping each other, bringing their behaviors into alignment with the secure model. And it works very effectively. So it's really a delight to do this work with couples. Not that it's not hard, sometimes the sessions are tough, but being able to get couples to rework their relationship model into a secure model is just so gratifying, because we know that couples that are able to have that security, they feel safe with each other, they feel valued, they feel supported. supported, they feel understood, they feel an intimate, deep connection with their partner, unlike a connection that they have with anybody else. So getting people into that secure model brings so many benefits. It's just really very gratifying to see couples be able to rework themselves and reach that place of security. So that's one big piece of what PACT therapy does. Okay, really quickly, the other big piece of what PACT therapy does is it works with what we know about the brain and the nervous system. And so this is the field of interpersonal neurobiology. And again, Alan Shore has done a lot of this work, Dan Siegel has done a lot of this work, and Stan Tatkin has studied with Alan Shore and Dan Siegel, and so was able to graft some of this into PACT. So we're teaching people about their brains and their nervous systems, what their brains do well, what their brains maybe struggle with, where they are in their nervous system, what it feels like to know that you're beginning to move up in activation and get triggered. What happens when we move up into the higher ranges of activation in our brain and nervous system? Literally, what's going on in those brain structures where we begin to lose focus on the us and we begin to pull back into this me position, and we get defensive and we get rigid and we get protective, and we may go on the attack. And those are all signs that we're being activated into some of these lower brain structures in the limbic system. And so helping couples understand the context for their behavior and for the behavior of their partner from this lens of the brain and the nervous system. And then again, after understanding comes modification, just like with attachment. So once we understand, okay, I now understand when my partner and I get into a shouting match that we're no longer engaging our frontal cortexes, and that's why we're being so mean to each other. Then moving from understanding to modification. So how do I get control of my nervous system? What are some tricks and tips that I can do to learn to regulate myself? And what can I do to regulate my partner? Because the interpersonal part of interpersonal neurobiology is that one brain and nervous system affects the other brain and nervous system in this moment-to-moment, dynamic, reciprocal, and very real back and forth signal and response system. So not only understanding how to get a hold of our nervous system, but understanding how to reach out to our partner's nervous system and move them into a place where their brain can be integrated and cohesive and they can really be their best self. So again, it's helping couples to look through this lens, whether it's the attachment lens or the interpersonal neurobiology lens, understand themselves and their partner, and then modify these behaviors to bring them into alignment, into this secure dynamic that we have researched and really fully understand, and we know is so predictive of healthy, vibrant, close, really lovely relationships. So that's PACT in a nutshell. One other thing I would like to say about PACT therapy that is different that you should be prepared for is we use longer sessions. My husband and I went to couples therapy as a young couple, struggling, trying to find our way, and we saw several different therapists, and each one had their own style. However, they all saw us for about 50 minutes, and what would predictably happen is we would come into the session, we would settle in, we would start discussing a problem we'd been having, we would start to really feel emotional about the problem, and then the therapist would say, well, it looks like we're going to have to pick this up next week, and usher us out the door in a state of distress. And I really remember feeling demoralized and wondering if we were going to be able to find our way in this marriage because we couldn't seem to ever make progress on things. We could kind of stir the pot, but we couldn't ever get to the other side and have any resolution. And one of the things that Stan Tatkin was so insightful about is he said, that's setting couples up for failure. We need time. We need time to go through what he calls the arc of a session, where we can not only peel back the layers and find the problem and get people feeling their feelings about the problem, because that is important, but then try some interventions, practice those interventions in the session, see if we can hit upon something that is going to shift that dysfunctional dynamic, have couples experience that in the session, not sending them home to do this as homework, but doing it right there in the session because we have time. And so PACT sessions are longer. In my practice, I use a 2-hour session. I know other PACT therapists who use 3-hour sessions. Some PACT therapists even do what are called intensives, and that's a 4 or 5-hour session. So, of course, not everybody can do a 4 to 5 hour session every week. That would be more of kind of a one-off thing. But just be aware, if you're interested in PACT therapy, that you're probably going to be using longer sessions, but there's a very good reason for that. And what I see my couples able to do, again, is get into a problem, feel their feelings around the problem, be dysregulated, get some help trying to figure out some strategies that might be more effective, try those out on their partner, assess whether or not that's working, and then find something eventually that does work, and then feeling that satisfaction of having gotten to the other side. And that is just a really nice place to land with folks before they have to leave your office at the end of the session. So PACT therapy uses longer sessions. I hope I've gotten you excited about PACT therapy. The PACT website has a therapist directory. We have PACT therapists all around the globe, not just in the United States. So hopefully you'll be able to find someone. And the last two things I want to say about couples therapy, and this is not particular to PACT, but because I really believe in couplehood, I want to extend this just in regards to all coupleships. Couples therapy is effective. There was a study done by the American Psychological Association, a large-scale study that surveyed many couples who had been to couples therapy. And the results were that 75% of those couples felt that couples therapy had made a positive difference in their relationship. So 3/4 of people that go to couples therapy report feeling like it really does help, and so that's really encouraging. That's the positive news. The sad news to me is that other studies have looked at how long couples are in distress before they go to couples therapy, and shockingly the average is 6 years. And as a person who's partnered and as a couples therapist, it just makes me sad that people will struggle for so long before thinking that maybe a professional could help. So please don't wait. You don't have to be married to be in couples therapy. You don't even have to be living together to be in couples therapy. I have couples who are just dating and living separately and not engaged and not married for sure. And they're coming and they're recognizing the benefits of learning more about themselves and how they relate to partners and their patterns, and learning healthier relationship skills. So it's never too early to go to couples therapy. Try not to be one of those couples that waits for 6 years, because at that point there's a lot of water under the bridge and a lot of damage that needs to be cleaned up. And that can be done, but it's just a bigger job for everyone. So I really recommend early intervention. And I hope that you will consider PACT therapy. I have found it to be a really effective and enjoyable model as a therapist. So thanks for listening, and take care.